everyone, this is Pratika from Mangaluru. I'm gonna talk about National Health Policy in this video. The National Health Policy aims to offer superior health services to every age group and gender. The policy focuses on providing universal access to excellent quality healthcare services at a reasonable cost, promoting healthcare orientation in every developmental policy. A national health policy was last formulated in 1983, and since then there have been marked changes in the determinant factors relating to the health sector. Some of the policy initiatives outlined in the National Health Policy 1983 have yielded results, while in several other areas the outcome has not been as expected. In 2002, the Ministry of Health and Family Welfare introduced an updated health policy. In this policy, they outlined the achievements and drawbacks of the 1983 policy and drew up new plans for the sector. Some of the achievements of the NHP 1983 were: NHP means National Health Policy of 1983 were positive changes in the incidence of diseases such as polio, malaria and leprosy, decline in the crude birth rate, crude death rate and infant mortality rate, improved infrastructure in the form of more beds, centers and health personnel. Even with mentioned achievements, some of the rates were too high when compared with the international community. The NHP 1983 could not address certain newer issues in health such as HIV or AIDS, or lifestyle diseases such as diabetes, cancer and cardiovascular diseases. Another major concern was the macro and micronutrient deficiency, especially in women and children. The National Health Policy of 2002 was the second major endeavour towards strengthening the public health care system in India. National Health Policies of 2017. Details of major highlights of National Health Policy of 2017 are as follows. I'm gonna show it. First one, assurance-based approach. Policy advocates progressively incremental assurance-based approach with focus on preventive and promotive health care. Second one is healthcare linked to health facilities. This policy recommends linking the health card to primary care facility for a defined package of services anywhere in the country. Health card linked to health facilities. Here health card is linked to primary care facility for a defined package of services anywhere in the country. Third policy is patient-centric approach. What does it mean? This policy recommends the setting up of a separate empowered medical tribunal for speedy resolution to address disputes or complaints regarding standards of care, prices of services, negligence and unfair practices, standard regulatory framework for laboratories and imaging centers, specialized emerging services, etc. This policy recommends the setting up of a separate empowered medical tribunal for speedy resolution to address disputes or complaints regarding standards of care, prices of services, negligence and unfair practices, standard regulatory framework for laboratories and imaging centers, specialized emerging services, etc. Next one is micronutrient deficiency. Micronutrient deficiency. This policy focuses on reducing micronutrient malnourishment, and systematic approach to address heterogeneity in micronutrient advocacy across regions. Next one is quality of care. Public hospitals and facilities should undergo periodic measurements and the certification of level of quality. Focus on standard regulatory framework to eliminate risk of inappropriate care by maintaining adequate standards of diagnosis and treatment. Next one is Make in India initiative. This policy advocates the need to incentivize local manufacturing to provide customized indigenous products for Indian population in the long run. Next one is application of digital health. This policy advocates extensive deployment of digital tools for improving the efficiency and outcome of the healthcare system and aims at an integrated health information system which serves the needs of all stakeholders and improves efficiency, transparency, and citizen experience. Next, private sector engagement for strategic purchase, for critical gap filling, and for achievement of health goals. At present, there is no proposal under consideration of the government to make health as a fundamental right. However, National Health Policy 2017 advocates progressively incremental assurance-based approach with focus on preventive and promotive health care. The National Health Policy 2017 recognizes that improved access, education, and empowerment would be the basis of successful population stabilization. The policy is imperative to move away from camp-based services with all its attendant problems of quality, safety, and dignity of women, to a situation where these services are available on any day of the week or at least on a fixed day. The process of formulation of the new National Health Policy entailed wide consultation with multiple stakeholders, regional consultations, approval of Central Council of Health and Family Welfare and group of ministers. The Cabinet in its meeting held on 15th March 2017 approved the National Health Policy 2017, a statement showing per capita expenditure on public health in India with regard to other select developing countries in 2014 is given below. Source is from WHO Global Health Expenditure Database 2014. The National Health Policy 2017 envisages rising public health expenditure progressively to 2.5% of the GDP by 2025. Activities in Northeast region. First one is National Rural Health Mission in Northeast. Second one is Northeastern Indira Gandhi Regional Institute of Health and Medical Sciences, Shillong. Second one is a thriving tertiary care medical and teaching institute. It's a tertiary care medical and teaching institute. Third one, Regional Institute of Medical Sciences, Imphal. Established in the year 1972, it is an institute of regional importance catering mostly to the needs of northeastern region in the field of imparting undergraduate and postgraduate medical education. Fourth one, LGB Regional Institute of Mental Health, Tezpur, Assam. This was established in the year 1876. It's recognized as one of the oldest centers providing quality mental health care and treatment. Regional Institute of Paramedical and Nursing Sciences, Aizawl. It was established in the year 1986 to cater to the education in the field of paramedical nursing and pharmacy. Next, National Program for Control of Blindness in Northeastern States, National Leprosy Eradication Program, National Iodine Deficiency Disorders Control Program, National Program for Control of Fluorosis, National Program for Prevention and Control of Cancer, Diabetes, Cardiovascular Diseases and Stroke. Quality control in food, drug and medical devices. First one, Food Safety and Standard Authority of India, FSSAI. Established under Food Safety and Standards Act 2006, which consolidates various acts and orders that have hitherto handled food-related issues in various ministries and departments. FSSAI has been created for laying down science-based standards for articles of food and to regulate their manufacture, storage, distribution, sale and import to ensure availability of safe and wholesome food for human consumption. This is the Food Safety and Standard Authority of India. Next one, Central Drug Standard Control Organization, CDSCO. This is the Central Drug Authority for discharging functions assigned to the central government under the Drugs and Cosmetics Act. CDSCO has 6 zonal offices, 4 sub-zonal offices, 11 port offices and 6 laboratories under its control. Major function of CDSCO is regulatory control over the import of drugs, approval of new drugs and clinical trials, and to safeguard and enhance the public health by assuring the safety, efficacy and quality of drugs, cosmetics and medical devices. Third one, National Institute of Health and Family Welfare. It is an autonomous organization under the Ministry of Health and Family Welfare. Government of India acts as an apex technical institute as well as a think tank for the promotion of health and family welfare programs in the country. Some of the major thrust areas under NIHFW are as follows, like health and related policies, public health management, health sector reforms like e-health, economics and financing, population optimization, reproductive health, hospital management, communication for health, and then training technology. Now let's see about Department of Ayush. Department of Indian System of Medicine and Homeopathy. Department of Indian System of Medicine and Homeopathy. ISM and H was created in March 1995 and renamed as Department of Ayurveda. Renamed as Department of Ayurveda, Yoga and Naturopathy. Unnani, Siddha and Homeopathy. See Ayush here. Ayurveda A, Yoga Y, Naturopathy N. Unnani U, Siddha S, Homeopathy H. This together, okay? Yoga and Naturopathy. Yoga, Ayush, Ayurveda. Okay? Ayush. In November 2003. In November 2003. With a view to providing focused attention to development of education and research in Ayurveda, Yoga and Naturopathy, Unani, Siddha and Homeopathy systems. The department continued to lay emphasis on upgradation of Ayush educational standards, quality control and standardization of drugs, improving the availability of medicinal plant material, research and development and awareness generation about the efficacy of the systems domestically and internationally. The Department of Ayush has 3 subordinate officers. 3 subordinate officers. Those are Pharmacopoeia Laboratory for Indian Medicine, Homeopathic Pharmacopoeia Laboratory, Pharmacopoeia Commission for Indian Medicine. Then one public sector undertaking, Indian Medicine Pharmaceutical Corporation. This company taking Indian Medicine Pharmaceutical Corporation This company is having a mini Ratna category 2 status. 2 statutory organizations like Central Council of Indian Medicine and Central Council of Homeopathy, and 5 research councils like Central Council of Research in Ayurveda and Siddha CCRAS. CCRAS, CCRUM means Central Council for Research in Unani Medicine. Then CCRH, Central Council for Research in Homeopathy. Then CCRYN, Central Council for Research in Yoga and Naturopathy. Then CCRS, Central Council of Research in Siddha. 11 educational institution. Department of Ayush has 11 educational institution and National Medicinal Plant Board, and also has National Medicinal Plant Board. That's all about Department of Ayush. Now let's go to Department of Health Research. Department of Health Research. Here, the President notified the creation of the Department of Health Research under the Ministry of Health and Family Welfare through an amendment to the Government of India Rules 1961 on 17th September 2007. Second point is the Department of Health Research was formally launched on 5th October 2007. Department of Health Research. Department of Health Research was formally launched on 5th October 2007. The main business allocated to this new department is the promotion and coordination of basic, applied and clinical research. The main business allocated to this new department is the promotion and coordination of basic, applied and clinical research. Now, National Health Research Policy. Here, the Department of Health Research. Department of Health Research, DHR, Department of Health Research has formulated a draft of National Health Research Policy. National Health Research Policy. The main objective of the National Health Research Policy is to identify priorities for effective and ethical health research to enable the achievements of the objectives of National Health Policy 2002, NRHM, Bharat Nirman and National Food Security Act, as well as global commitments such as MDG and IHR, ensuring that the results of health research are translated into action. NRHM means National Rural Health Mission, which seeks to provide quality healthcare to the rural population, especially the vulnerable groups. Under the NRHM, the Empowered Action Group EAG states as well as northeastern states Jammu and Kashmir and Himachal Pradesh have been given special focus. Indian Council of Medical Research, ICMR, Indian Council of Medical Research ICMR, the apex body in India for the formulation, coordination and promotion of biomedical research, is one of the oldest medical research bodies in the world. It is the oldest medical research bodies in the world. It was set up in 1911 with the specific objective of sponsoring and coordinating medical research in the country. It was redesigned in 1949 as the Indian Council of Medical Research with considerably expanded scope of functions. The Council's research priorities coincide with the national health priorities. All these efforts are undertaken with a view to reduce the total burden of disease and to promote health and well-being of the population. The Council promotes biomedical research in the country through intramural as well as extramural research. Intramural research and extramural research. Intramural research is carried out currently through the Council's 33 research institute centers or units. 33 institutes, centers or units. Extramural research is promoted by ICMR through setting up centers for advanced research, task force studies, open-ended research and ad hoc projects and fellowships. Department of AIDS Control. Department of AIDS Control. National AIDS Control Organization is a division of the Ministry of Health and Family Welfare that provides leadership to HIV or AIDS control program in India through 35 HIV or AIDS prevention and control societies. 35 societies. In 1986, the detection of the first AIDS case in the country, the National AIDS Committee was constituted by the Ministry of Health and Family Welfare. As the epidemic spread, need was felt for a national-wide program and an organization to steer the program. In 1992, India's first National AIDS Control Program 1992 to 1999 was launched and National AIDS Control Organization was constituted to implement the program. 1992 to 1999, NACO was constituted to implement the program. NACO means National AIDS Control Organization. This was followed by NACP2 in 1999. This was followed by NACP2 in 1999 and NACP3 in 2007. During different phases of the program, the focus shifted from raising HIV or AIDS awareness to behavior change, from a national response to a more decentralized response, and to increasing involvement of NGOs and networks of people living with HIV or AIDS. NACP3 2007 to 2012. NACP3 2007 to 2012. Overall goal of NACP3 is to halt and reverse the epidemic in India over the next 5 years by integrating programs for prevention, care and support and treatment. This will be achieved through a 4-pronged strategy. First one, preventing new infections in high-risk groups with targeted interventions and scaled-up interventions in the general population. Second one, providing greater care, support and treatment to larger number of PLHA. Third one, strengthening the infrastructure, systems and human resources in prevention, care, support and treatment programs at district, state and national levels. Fourth one, strengthening the nationwide strategic information management system. The specific objective is to reduce the rate of incidence by 60% in the first year of the program in high prevalence states to obtain the reversal of the epidemic, and by 40% in the vulnerable states to stabilize the epidemic. Wider access to antiretroviral therapy has resulted in decline of the number of people dying due to AIDS-related causes. Okay, next let us move on to international cooperation, that is World Food Program, Food and Agricultural Organization, G20 Matters, International Grains Council Training Program. International Corporation. First one, World Food Program. India allocates food grains under a Country Program Action Plan CPAP 2008-2012 signed between the Government of India and the United Nations World Food Program WFP. Allocation of food grains, rice and wheat have been made by Department of Food and Public Distribution at BPL issue prices for the development schemes to be utilized in various WFP assisted projects in India. A total quantity of 1,65,065 tons of food grains has been allocated during 2008 to 2011. The Country Program 2008 to 2012 is extended up to June 2014 to facilitate the transition in new country strategy. second one, Food and Agricultural Organization FAO. FAO is one of the largest specialized agencies in the United Nations system, founded in 1945 with the mandate to raise levels of nutrition and standard of living by improving agricultural productivity and living condition of rural population. The Committee on World Focus Security serves as a forum in the United Nations system for review and follow-up of policies concerning world food security, including food production, physical and economic access to food. India is a member to both FAO and CFS. CFS means Committee on World Food Security. Committee on World Food Security monitors the progress of implementation of the WFS plan of action. Now G20 matters. A steering committee has been constituted in the Department of Agriculture and Cooperation under the chairmanship of Secretary ANC to oversee the development. ANC means Agriculture and Cooperation. To oversee the development, follow-up action on the initiative declared in Ministerial Declaration endorsed at G20 Agricultural Ministers meeting held in June 2011. June 2011. Fourth one, International Grains Council. India is a member of the International Grains Council as intergovernmental forum of exporting and importing countries for cooperation in wheat and coarse grain matters. It admires the Grains Trade Convention 1995. This is IGC. IGC has two types of members, importing members and exporting members. India has been included in the category of exporting members. India has been categorized for exporting members. Exporting members in 2003 July. And represented in the meetings or sessions of the council held from time to time. Next comes training program. Training is one of the effective and tested tools for performance enhancement as well as upgradation of knowledge and skills of the personnel, organizational motivation and morale as reflected in the attitudes and administrative culture are rendered through relevant and sharply focused effective training programs. Thank you for watching. If you like the video, do like, share and subscribe. Thank you. Please do watch many more videos in my link, my channel for 8th standard students too. Thank you. I have put up some videos on menstruation for 8th standard students. It will be very helpful. Thank you. Thank you. Bye bye. See you in the next video.